Two different tests which can detect coronavirus and flu within 90 minutes are to be rolled out, mostly in hospitals in England from next week. The labs which have devised the tests say they are more reliable than current swab tests with almost 100% accuracy. Our health editor Hugh Pym has more.
Get your head up, facing back.
Katie, a hospital pharmacist, is being tested for COVID-19. She'll only have to wait 90 minutes for the result. It just needs one nasal swab, and then this machine detects any genetic material from the virus. It can reject the sample if it hasn't been gathered properly. She tested negative. During a trial period, it's helped the hospital manage patients coming in for treatment.
Previously, we were having to wait 24 hours or longer to get our swab results back. And this meant that we were needing to use lots of side rooms to isolate patients. And this means that we can actually cohort the right patients in the right places really rapidly.
At a high-tech factory near Oxford, another rapid testing system for COVID-19 is being produced, initially for use in hospitals, but in due course available for care homes and other health locations. What's more, it will in time be capable of detecting flu viruses as well, an important asset in winter.
When you add those two together, it will result in people wanting to test more. And the more we test, the more people get confident, the more people will test. And it's a self-fulfilling upward spiral.
The government has signed contracts with the two companies, Oxford Nanopore and DNA Nudge.
More people are going to be able to get tested more quickly so we can find out where the virus is and tackle it and keep those rates of infection down.
And the two British innovations, along with others producing fast test results, have been praised by the World Health Organization.
It is really, again, incredible the amount of tests that are being developed and the fact that we have rapid tests that are being developed. This is a positive thing, and this will help control efforts.
Some experts, though, have called for more detail on the performance of the different testing systems.
It's really important that we get good data to understand are there compromises in accuracy with having a higher speed test.
At this stage, these technologies will be focused on hospitals and the testing of patients and staff. But the big question is, can they, with others, be extended to help with the mass community testing in different settings, which is seen as vital if the virus is to be kept in check? Some social care organisations have complained of problems getting any virus tests. This care home looks after adults with learning disabilities and has had no supplies of kits for 9 weeks. So there's a little scepticism about the latest announcement.
I worry that actually is there going to be enough tests to roll this out across the whole of social care for staff and residents? And yeah, I think we've been told so many things that are then U-turned on, that whether this is actually going to materialise into something or not.
I need to take a sample from the back of your throat.
Walk-in and drive-through testing sites have expanded rapidly, but there's a 24-hour wait for results. The new systems are just a start in the move to something quicker and more convenient. Hugh Pym, BBC News.
Let me give you our evening update on coronavirus data in the UK. There were 938 confirmed new cases of COVID-19 in the latest 24-hour period. The 7-day rolling average is 789 new daily cases. You can see from the chart that the number is rising. 9 deaths were also recorded in that same 24-hour period. That number includes people in England who've died after having a positive test at any point. But for Scotland, Wales and Northern Ireland, it's anyone who's tested positive in the last 28 days. It takes the total number of deaths in the UK to 46,210. And on average in the past week, 64 people have died every day from coronavirus. Now, some of the lockdown restrictions imposed on Leicester at the end of June after a rise in the number of cases there have been relaxed. But parts of the north of England are facing tougher rules. Our science editor, David Shukman, looks at the picture around the country.
Life returning to Leicester, the first city to have had a special lockdown imposed on it until today.
It has been tough from a business point of view and tough from a client's point of view because they've been desperate to get in and they've been really loyal and they've been waiting for us. So now we're open and obviously things are starting to move again. So we're just so happy that we have the opportunity today to get back to what we love.
The restrictions were brought in after a surge in coronavirus cases. And the mayor of the city is really hoping it won't happen again.
It's amazing over the day today to see how the city has come back to life. It's not quite back to what used to be called normal, but it's looking pretty good.
So with the situation in Leicester improving, where is the virus causing concern now? Well, the key thing is that across large areas of the UK, levels of infection are relatively low. We're a very long way from the bad days of March and April. But there are hotspots with spikes in the disease, and these areas are the 10 worst affected right now, from Swindon in Wiltshire to Wrexham in Wales to a cluster in northwest England, and other outbreaks are bound to emerge. And one idea to detect new flare-ups is to search in the sewage. Scientists have found traces of the virus in wastewater. This could provide useful early warning. So with these new outbreaks, who is it that's getting infected? There are signs that more young people are now picking up the virus. This was Manchester last Friday. Generally, the younger you are, the less likely you'll suffer from the disease, but you could infect more vulnerable people. So how is the virus spread? Where does that happen? Public transport is one potential environment where infections can be passed on. But mostly it's households, according to the latest studies, with people close together, indoors, for long periods of time. And one leading scientist says great care is now needed.
Where we find ourselves is in a sort of a little bit of a knife edge, a bit unstable. Things are obviously just under control at the present time. And the way I view it is this gives us time. It gives us a month or two when we can sort everything out so that we can deal with a situation which is likely to get worse as we go into the winter.
And the best ways to control the virus are the most basic. Good hand hygiene is crucial, along with face coverings and keeping a safe distance. There aren't that many options until a vaccine comes along. David Shukman, BBC News.